Doc is back. Welcome to Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join Doc and his guests as they discuss healthcare and the Caribbean community every Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms.
I didn't grow up here, but Broward County has become home to me. This is where I settled. I raised my family here and started my practice here. For over 20 years, I've represented my neighbors, people who needed help in a stressful time. If you find yourself in need of an attorney, reach out to someone you can trust, someone with a proven track record.
When a car accident or personal injury sets you back, call Scott McCullough.
954-989-3435.
Hello, ladies and gentlemen, and welcome to this week's episode of Medically Speaking with Dr. Winston Alexis. Doc.
Yes, man. What's up?
You must tell me.
You know, it looked like Mr. Fauci opening up things slowly.
Yes.
My belief is that by summer, they don't want to make people too early. By summer, a lot of the restrictions will be lifted. I think mass is here until the end of the year.
Okay.
But you will be able to, I think the next step is for people to have functions, but you have to verify that you have been vaccinated before you can go to it.
Okay, reasonable.
Right, just like the airlines. And that's fair. Yes, you could have your party, but everybody who comes to this have to show that they have received vaccination.
Or test negative COVID? Or you don't
yeah, but if it's test negative COVID, how long ago? Right? And the point is that pretty soon testing it will not be necessary except for research purposes.
Right.
As far as getting herd immunity, vaccination is the thing.
That's the
right.
thing that
and
needs to happen.
As a matter of fact, I think in certain minority groups, this might be one way to get them to be vaccinated.
Well,
you could go to FET, yes, but you have to show your vaccination. And I know some man who want to FET, who I believe going to take the vaccination.
Well, I would gamble and say that the majority of our community ready to go and FET.
Once you say FET, okay, you have to go for vaccine. Where could I get it? Right, so I'm telling you guys who do some promotion, look ahead.
Yes.
That's the next step. So get ready.
All right.
Don't be left behind. Understand how you're going to set it up so that you could make something where if you have been vaccinated, you can come show proof. Not testing, vaccination.
Okay.
That you will be able. Now they're saying vaccinated people could stick together like in the homes.
Yes.
The next thing is if you could show you were vaccinated, you will be admitted to restaurants and.
Well, that would need to be something official then, though.
Yeah,
probably from the CDC and app. Maybe.
I say that's the next step. However, they would say once you go outside to mix with people who have not, wear your mask.
Right.
So that's not going to stop you from having to wash your hand and wear your mask.
Of course.
In everyday living. But if you could tell me 6 of my family could be together because we're vaccinated, give me a chance.
Yeah.
That means you could have sessions or large groups for people to show that they have been vaccinated before they can. Just like flying. If you want to fly, you have to take vaccinated.
Right.
In some countries.
Well, I am actually, quite pleased with the progress that the president has made with his plans for distributing the vaccination.
Right. And I think he's very smart because he intentionally lower expectations.
Yes.
With the 100 million and 100, it's going to be a whole lot more than that. I think by 100 days, we will reach the magic number. But remember again, magic number doesn't mean you wouldn't have to wear masks some more.
Of course.
You understand? But for instance, when you go to a restaurant, you'll be able to eat and keep your mask down. Things like that groups allowed together will be more than we are doing now. But it's not going to be a day where they get up and say, okay, we all free.
Right.
It's going to be a gradual thing. I think that will go well into the early next year for as far as everything, where you don't have to wear a mask, you don't have to show any proof that you've been vaccinated. I think that's the next step.
Well, again, we look forward to it.
Right, and the gist of this whole program that we have had over the years, that Caribbean Connection is trying to make, is that we are not left behind.
Mm-hmm.
We need to understand how this country operates. We need to read between the lines, something you have to learn to do, right? And again, let me make something clear. I know I recommended WebMD and Mayo Clinic. However, these are still for-profit organizations, but they have a lot more integrity than Dr. Google. You understand? So if you're going to get advice from it, and by the way, when you read these things, look for the word advertisement, because they put something and they hide the advertisement.
Right.
And you think the advertisement is what they are touting. You understand? And all of this we have to learn about this country. Fine print is important.
Again, reliable and I guess just reliable sources.
Yes.
That's the most important thing.
Like Caribbean Connection podcast.
There you go.
How is it reliable? Because of me.
Of course.
And you?
We're two of the most trustworthy people.
Oh, I like this.
Yes.
I like
Without
this.
a doubt.
I like the big up, even though we're bigging up ourselves.
No, that's all right, Doc. Somebody have to do it, though.
Yeah, but that's one anything important in America. You have to promote yourself.
Yes.
Ain't nobody going to sit down and say, Doc is a good guy, let me promote.
All right.
Right. For instance, all those white folks you see on the talk shows, in health on TV. Mr. Barnes, all of we have been doing that for years.
Yes.
But we ain't got no connection, we ain't got nothing, so here we go.
All right. Well,
all right, so...
We get in there. We're working our way to
that. That's about what we talked about just a while ago. We have to learn what is happening in healthcare too.
That's right.
Right? That all of America is not created equal. And healthcare is not exempt from that.
Right.
Yeah, we have crooks, we have all kinds of people, we have good people, so we have to learn where our resources are, who is to be trusted and who is not to be
identify the good from the bad.
Right.
Well, Doc, that's the perfect segue actually into the topic that I have for you for this episode.
Okay.
So I want to talk a little bit about the disparity in healthcare with minorities in comparison to mainstream.
All right. Let me try and give you a little background from medicine. And by the way, this is true for all aspects of life, but I could give you what happened in medicine. Never had racial prejudice. And nobody hated you as a doctor because you're black.
Okay.
But there was systemic racism present. The system was set up so in medicine. It's set up so in government. It's set up so in business that there are disparities that's so well camouflaged that even good meaning white people, you heard of this? Never realized they were racist or they were part of racial injustice. They themselves are not racist.
Right. But they're participating.
And supported many of them unaware that they are. And I could tell you what happened in medicine years ago. All right? We went through something where I went to one of the 4 medical schools that black people could go to. Notice I ain't saying all when I came to this country. Back in the late 50s, there's only a few schools you could go to, 2 as a matter of fact. Howard University and what's the other medical school in Tennessee? I will tell you, right? I'll Meharry.
Okay.
The only 2 That's why anybody who graduated in the late 50s or 60s in medicine that's black, you could tell them what school they went to.
Got it.
Even the Ivy Leagues were not taking the token blacks yet in medicine. All right?
Interesting.
So, again, so what they did knowingly was to make the entrance the requirements so impossible that black people couldn't apply to any other school.
Now, was this from academics or financial?
Never academics. Financial, social, all kinds of things. That legislation. In holding down, for instance, where black students could get loans to go to medical school, they were not existent.
Got you. Okay.
All right? As a matter of fact, most of the blacks at Howard University, a significant portion of the minorities came from the Caribbean and Africa. All right? We had, as a matter of fact, we had 25% non-African American. Notice I ain't saying black. Non-African American. And we have 100 in the class. So 25 out of this 100 could be foreign blacks, like me, Jews, and women. Believe it or not.
Okay.
Any color woman.
So are you saying then that females had that challenge also?
Oh, yes.
If they wanted to go to medical school?
Oh, yes. They were segregated. And again, just like racial, it wasn't, they didn't put it that we hate women, but they made it so difficult. In other words, no school had any rule you can't admit a woman. What the woman had to go through to get into the school, and it was ingrained. They hid it, and they did all kind of things so it is not quite obvious what is being done. Right? And that's the difference to me between racism, all right, and what's the word I'm looking? Institutionalized racism.
Gotcha.
Pure racism is, boy, I hate him because he's black.
Okay.
You don't see much of that now anymore, you know.
No, not too much of that.
But they make it so negative that the chances of you succeeding within this system, right? And nowhere else is it more common than in healthcare. Right? I think, I don't want to give you the big good figures. I think it's like 25,000 white guys applied to medical school, 325 black.
Okay.
Not that they're smarter, not that they...
Right.
The money is not available. We make the requirements so hard with grades and things that they know black people don't want to do. Right? And that's how... And that's what the schools used for segregation back in the day. Right? And they're smart, you know. They started a rule that if you take... you can't get federal funds. That's during Kennedy and what's his name there, who succeeded Kennedy? Johnson.
Okay.
You have to admit a certain amount, otherwise you can't use government funds. And all those medical schools use government funds.
Of course.
So what they started to do was to admit a token few and kick them out by the second year. They didn't say you have to keep them for 4 years, you know. You have to show Georgetown was in that. Down the street from GW was in that. The first few people that when the law came out, you know, during all those equality laws that came up. They're stupid. I remember UNC, you know, in North Carolina Medical School was one of the one. One of my friends went down there and by the second year I see him driving taxi. What are you doing here? Say, boy, things was rough and they ain't giving us no help. I talk about help academically. So I they kicked me out and I had to come back DC and drive taxi. So that sort of thing is where I remember it started back then. Let's talk in terms of the patients now. All right?
All right, Doc, hold that thought. We're going to take a short break, and then we'll be right back.
Dr. Ronald Moore and his team at Minimally Invasive Surgery perform laparoscopic robotic procedures with the utmost precision. As a bariatric surgery specialist, Dr. Moore performs a range of surgeries and operations focusing on areas and organs of the abdomen. For gastric sleeve, bypass, and banding, to endoscopic balloon and hernia procedures, call the Office of Minimally Invasive Surgery at 954-797-4220 to schedule your appointment. Minimally Invasive Surgery has 2 convenient Broward County locations to serve you. Call 954-797-4220 to schedule your appointment today.
And we're back to Medically Speaking with Dr. Winston Alexis. So, Doc, so you brought us up to speed on where you believe this whole thing started. All right? And the disparity started with actually getting minority physicians trained.
Exactly.
Okay. So, again, we're going to move on to know where that kind of translates into the patients, minority patients.
Sure.
All right.
All right. And that's the word rather than black.
Yes.
Because we have to include our South American. Notice I'm being particular.
Yes.
Talking about Cuba, talking about our South
American
Latino is included in the group, and North American Indians, Native American, they are included in the group. I'm talking white. So they use words like non-white, or minority, or brown. But we know what they're talking about. But the first thing you have to realize, this is not a race issue. It is about the have and the have-nots.
Okay.
And it so happens the have-nots, the majority are black and colored people.
Right. And the truth of the matter is where we are from.
Yeah.
Right?
Yes.
Jamaica, Trinidad, wherever it is, we have the same thing.
Yes.
The same thing applies.
Everywhere in the world.
Yeah.
We just need to know how it shows itself up here and how to attack it.
How to navigate it.
I can't help letting people know a racist is different from a guy who's supporting racist attitudes and getting the system is prejudice against these people, and you fall for the fact that, it's only because the poor people don't like to work and poor people lazy, right? And many of them say, no, a guy actually wrote, he said, I'm a prejudice right man for years and didn't realize it because I didn't want, to me, my African brothers could live where I want. But he don't understand that may be true, but you can't begin to satisfy the needs to go into a white that's required to go live in most white communities. And they do it by making the prices high. They do it by making all kinds of rules with credit. Right? To make sure you don't. So that's happening in healthcare.
So give me some examples of where you see now the impact to the patient.
All right. Let me tell you, first of all, I did a big article in WebMD. Where are the black physicians? And the second part of the article was, without a question, every study shows that black people get better care from black physicians. So the very fact that we don't have enough black physicians is one of the reasons our people get poor health care. We don't have enough to take care of the diaspora. So they branch out into other areas. So that's the first thing they do. Restrict how much colored and black, brown and black people could become physicians. Right now it's like 25,000 in the initial, each class are whites, and it's like 260, 300. What kind of ratio is that?
So is it though, and I'm being a little controversial here.
Yeah.
Could it be though that the career is not as respected as it once was, or because it's not as lucrative as it once was, or whatever.
And who tell them that?
I don't know. I'm just asking.
Well, I'm asking you back. Who you think tell them that? Who say that's true?
Are you saying that is information
that's part of it?
Really? Okay. All right.
To discourage my people from going into medicine. You never hear this story, but I hear it all the time, even now. Little young girl tell me she want to do business. I say, business? Number one, you're black and female. That's the lowest on the business totem pole. Mm-hmm. It's white, male. Mm-hmm. Believe it or not, it's black, male. It's white, female. And you bringing up the garbage dump. Will you tell me you're going into business unless you have real money? Right. You're going into business. So I say, as a young woman, a professional, look at my daughter.
Doctor.
She don't have to ask nobody nothing. You're a professional, you're an engineer, you're a doctor, you're a lawyer.
Accountant.
Right. Own your own business. Mm-hmm. But when I ask them business, so what part of business? So the argument now is medicine is no longer lucrative, right? Nobody is talking about all the good things you get from medicine. Mm-hmm. Like I have received, some of them I can't even tell you.
Right, well, we're not going to get
doctors get a lot of free stuff. You might think they don't, but they don't. They're treated with respect, they're treated with privilege.
Yes.
But they have bitten into this argument. Now, when you're in America, the only thing that matters is money. Mm. That's what they're telling my people. And medicine, you're making, by the way, you make a damn good living. You just say rich.
Of course.
But they teach them they need to be rich. I saw somebody telling me, I never heard any wealth. Wealth. Who is going to be wealth that you ever know, Tyrone? Wealthy? That's Trump and them. Wealth? Now I could make enough money to live a comfortable life for my and then respect becomes more important than caring.
And that doesn't appear to be enough nowadays.
Right. So we need to get our community, the young people, understanding this is still a glorious profession. And more than that, a needed profession. Why I say that? Our people need you. Because the statistics show they get better care with you. Right? And then they treat you with respect. And listen what happens now. Once they do this false narrative that doctors don't make no money, no black people don't want, you want to get rich like Trump and them, pulling that thing over your head. Mm. Black people have no right using this goddamn wealth.
And I don't want us to get sidetracked with that. So let's zone in on what you just said a while ago, which you have mentioned before,
right?
And I really want to dig into it a little more. Right. So, and you mentioned the fact that we'll use black people. Black people get better healthcare from a black physician.
There did studies to show it,
right? So, give me some. Or does it drill down now to culture, just out of curiosity? In other words,
I think it's more of a cultural problem than a race problem. That's the point. You bring it out for me.
Yeah.
Racism is in it, but it's not a person saying, oh, you black, I don't like.
Right.
That is not. The system is such. For instance, most brown and black people in this country are lower socioeconomic. Maybe a few in middle class. Mm-hmm. All right? So where do they get the health care? In the clinics and with Medicaid that the government pay for. Mm-hmm. And what is the government doing? Slowly decreasing the subsidies.
Right.
Less people could be on Medicare now. Mm-hmm. The hospitals are closing down, the big one. More private hospitals are opening up who don't want to take indigents. So you understand what is going on here. And not only that, my people buy into it. I'm sorry. Because I worked at clinics before.
Right.
And they get black people to look down on black patients. Don't treat them with the same dignity as when a white person come by. Mm-hmm. So not only have they put it in the system, they have bamboozled our people to look down on poor black people. So you understand what I mean by systemic? This is into the healthcare system at all levels, all. All right? And now, let me tell you the thing they do, the naysayers. They compare healthcare here with England, and England is doing better. Canada is doing better. Germany is doing better. Why? They are socialist countries.
Right.
And they offer general healthcare, same healthcare to every single human being in England. White, black, blue, and even the brown prince. You missed that?
I got you. I'm not taking you on. I'm not taking you on, but I got you.
Even the brown prince of England. What the heck was that? Anyway, let me come off of that before I get into trouble. Yeah. So you understand how the disparity is ingrained.
Okay. So let's talk a little bit about that now. So unfortunately, certainly in some areas of our community that I have seen, we've had programs and we've spoken about the importance of health insurance and and at least if you can't afford the top plan, have something.
Right.
All right. Now I have certainly seen it and I've heard it, that people are more content with not managing their health, but they'd rather drive the newest vehicle, or they would rather wear the nicer clothes or live in a nicer neighborhood, but not do what is necessary, one, to even have some kind of insurance, or two, not manage their health.
Yeah.
So
go ahead.
So the disparity, I agree. I'm trying, and again, I'm just really trying to stimulate some.
All right. Yeah, man.
Some conversation about the topic.
Yeah. And we need to do that. Take a kid.
Mm-hmm.
He's growing up.
Yes.
The whole society tell him there's a pecking order.
Mm-hmm.
At the top is the rich and famous, including all your athletes and actresses. All about money.
Right.
Right? And we come down the line. Right? And as we coming down the line, even to me as a physician, what is important to me now? Not healing anymore. MONEY. Because the society says you want the best in it, you got to have money.
Okay.
Integrity is no longer talked about in healthcare. Caring is no longer. All of that is done by offshoot organizations that develop little small groups.
So we need to stop calling it healthcare?
Of course. Of course. It's when you look at the narratives, that's why I say systemic racism. When they look at the TV and they see kids are impressionable. That's why all of them want to be football players.
Mm-hmm. True.
Right?
True.
Yeah, but how many doctors you see on TV? Rich, and they have them in commercials. The only doctor I remember is Dr. What's his name?
Which one? Trapper John?
He waiting for trial. No, what's his name?
Oh.
Yeah, but that's the only example we have of black. So we have to change the system. I'm seeing some of it. We have to see more like the commercials. Oh, I love them. There are black people in every one.
Yes.
Right? The kid need to look up and say, hey, there's nothing wrong with black. So maybe I'll take a... Secondly, we have to take it to ourselves, and that's part of what your organizations need to do. Go down in our community and promote to young black kids and the whole society what is important. Yes, money is important, but it's not God. Right? There's so many things you could enjoy without being extremely rich. So it's all about re-educating our community, and that's part of what, I ain't letting you all off the hook. That's what you guys are trying to do. Get the community together and educate them on what should be important to our diaspora and not following the guidelines you see on TV and stuff like this.
All right. Well, Doc, again, you're spot on as usual. Anyway, hold your next thought.
All right.
We're going to take a short break and we'll be right back. for the absolute best obstetrics and gynecology care, call South Florida OBGYN at 954-452-4377. Schedule your appointment today with Dr. Winston Alexis, who has been serving the women of South Florida for over 25 years. Conveniently located in Plantation, Florida, the courteous and professional team at South Florida OBGYN are standing by to assist you. Schedule your appointment today by calling 954-452-4377. And we're back to Medically Speaking with Dr. Winston Alexis. So, Doc, from where you sit, can you give me some examples of where and what you have seen pertaining to this disparity in healthcare?
Right. I'll give you something.
Minorities.
I'll give you something that breaks my heart.
Mm-hmm.
And I could only talk about my specialty. The others go through similar things, but in a different way.
Right.
The number one obstetrical problem in America is preterm births.
And
all right, definition.
Mm-hmm.
Anything under 37 weeks, 40 weeks is a normal pregnancy.
Okay.
Anything under 37 is undesirable, but not necessarily dangerous.
Okay.
Under 34
Mm-hmm.
is heartbreaking, is costly in terms of money and in terms of the mother's sanity and integrity. That is costing American billions of dollars to take care of babies that are born less than 34 weeks.
Okay.
All right? It's a big public health problem.
Mm-hmm.
When I tell you about the statistics, it's heartbreaking. But you know the statistic that hurt me most of all? Whatever the statistic is, 75-80% is in black people.
You're saying of all
term labor,
right,
which is the biggest problem in obstetrics in terms of money and heartbreak and everything.
Right.
And of whatever that figure is.
You're saying close to 80%.
Yes.
Is black or minority?
Yes.
Really? Okay. So,
75% of the minority is black.
Wow.
Right.
So what has the study shown what the major causes?
Yeah, but up to now, nobody has come up with a study with an answer. Why this disparity? Why white women who deliver the baby before 30, nobody wants a baby to be delivered, but when it happens, they do much better than the black women who deliver. Are we genetically inferior? No. Right? But because we have low income predisposing factors, stress.
I just about to say, I have the answer, stress.
Yeah, that's one, right? Economics.
Yes. 2,
can't get proper health care.
Mm-hmm.
Can't buy the medicines.
Right.
Do not live a lifestyle that is conducive to a normal pregnancy.
Mm-hmm.
Diseases like high blood pressure and diabetes, which is also related to stress and poverty and what you could afford to eat and not. Right? And we have made no real advances in solving this problem. Wait, hear this. You could spend so much money to go to Mars, and you can solve a little problem like this? No. Why? Nobody really cares.
Not a priority. Not a priority. I believe, based on what you have shared with me, that if somebody were to put a dollar figure to it and say, by the way, if you were able to solve this issue, you could make...
Yeah, but listen to this too. The flip side of this now. To keep those babies alive, and the average costs about $200,000. Of course, the mother can't pay for it, so the state pay for it.
Right.
Right? So they are spending more money in taking care of these children than it would take to go into a good program, study it, make sure people get good health care, pre-obstetrical care is related to preterm births. You understand?
Wow.
So they are not willing to spend this money
Yeah.
to solve this problem because it's lower socioeconomic. They rather play on the fifth side through taxes to take care of all these babies because we are not so-called savages in this country.
Right. Priorities are skewed, though.
Right. And what the government do? They're slowly dropping how much of those things we'll pay for. So what you think going to happen to the babies even? They're going to die. Right?
That's scary.
And you can compare it with other diseases that happen apparently in other people. Probably, I'm guessing, I bet you a lot of money probably spend more on autism. And autism is not either economic or social problem than preterm births. These babies end up blind, they end up failure to thrive, all kind of congenital heart disease, had to get heart transplant. You don't know. Keeping them alive, we as physicians has battled with the fact, but maybe we shouldn't use modern science to keep these people alive.
Right.
Because when you look at the end point, they're not useful in society and they're a burden economic-wise on the mother and the society. And we got criticized terribly for that. Because back when I was a resident, when we had a 24-week baby, right? If the baby lived, it ended up blind, all sorts of things. Can't walk. And at a time, the pediatrician had a thing. When they hear is a 24-weeker born, they used to take the time coming from pediatrics and literally hoping for this baby not to survive.
Oh, no.
But remember, that was back in the day when we didn't have the resources. We didn't even know.
And I would imagine that again.
We were being merciful.
Those situations.
Yeah, that's how we thought of it. And then...
But then, so tell me now, has from a care standpoint and from a medical standpoint, has any of that changed? In other words, their for lack of a better term, their progress and usefulness in life, based on modern medicine, science, or techniques,
has actually made it worse.
Really?
Because before they would die. But now we saving them, but we giving the parents something that is... You understand? We between a rock and a hard place. Don't matter. Right now, we save them.
Right.
But I'm saying, I hear it every time, boy.
So to be a little technical with it, you're saying that the root of the problem comes to the care.
Yes. You hit it on the head. What do we need to correct it? Easy. Universal obstetrical care. That's what I'm saying now. Every mother must have the same care, free of charge. Right?
Oh, that makes sense.
Yes.
That makes perfect sense.
That's why Germany better than us. That's why England better than us. That's why they all socialize.
There's a standard to this.
Thank you.
And a baseline to the care that expected mothers get.
And it's a lack of good prenatal care is responsible for this.
Interesting.
Yeah, I mean, go and look at the research. It's heartbreaking. And again, this is the system. That's where the disparity come from. Not hating black people, not hating that. We happen to be poor. So it's a cultural warfare. It isn't really race. Right? Because there are many people who say, oh, I'm not racism, but they support those programs.
Right.
They're not racist because I never say I hate you because you're black. Nobody does that anymore. Interesting. Except Q or whatever they
So let me ask this though. Do any of the programs? Let's use the system that you know about. All right. So you're based in South Florida. You know about the system here. You know the facilities that are available and all of that.
Yeah.
Are there facilities out there that
yes,
poor black woman can go to?
But let me tell you what happened. Many of them don't go use it.
Okay, all right. That's what I was getting at.
Because the system again tell them that is not good.
Okay.
Listen.
Okay.
For instance, let me give one example and I'll explain this. I ain't calling the name. Some people come to us for care. We said, Jesus, all of this money, I'm a good person. Why pay all of this money? I can get you into a clinic. That is, I work there time to time. That I know give you good care. The difference is, we have regular wood chairs. We don't have, you understand what I mean? We have one little old TV in the place and the room kind of fails. So you have to wait long. But I say wait long, but get the care you get from those places many times is better than black people get in a non-black practice on the outside.
Right. So I mentioned this, Doc, because this is where we come in. This is where what you and I are doing right now.
Yeah.
Okay. And what our organization, the Caribbean American Connection,
is about.
And where other organizations like us, we have an opportunity to share this information with people. And that's why I ask. And it starts obviously with our backyard, you know.
Yes.
We need to let these people know that, listen, this statistic exists, just as an example.
Yes.
Right? And well over 75% of people who suffer from this situation are black.
Yes.
Right?
Yes.
And the reason that you're even suffering from this situation is because of prenatal care.
Yes.
Right? And guess what? You can get prenatal care here if you cannot afford to pay for it, or if your insurance doesn't cover, whatever the case may be.
You want to hear something? Even if you can afford, it is still a good case, because many times these structured places are better than private.
Okay, so what?
People.
So
but the system don't cry it. Oh, it's so and so clinic. Oh, it have 25,000 people there every day.
That's right.
Oh, there nobody there know how to talk to nobody. Again, that is the word on the street.
Right.
That the man has spread.
So again,
and that my people believe. One of your job, one of you guys' job is going to locate these resources and then educate our people on them.
Absolutely.
I send people and I said, don't listen to what people say. You have to wait long, but the care,
of course,
is as good as you could get anywhere. I'm telling you that right now.
All right.
Because not everybody give OB care like us. Let me big up myself a little bit.
But everybody knows that. Though.
But not everybody who can pay knows it.
Right.
And I send them in the right direction all the time.
Yes.
And I warn them what they're going to. And I'm saying, listen, put aside the embarrassment you may feel going to this again, the system again. Right?
So,
and look at the quality of the care you get.
Post-pandemic, one of the things that I am going to discuss with my partners, my business partners, and you, is that we do something, some kind of social event, periodically, from one of those facilities.
Yeah. So in other words, we drink rum, but we raise some... No, are you... Let's be fair with our people.
Yes,
we are talking about a tea party.
No. I'm talking about
an event. I like that word. Yes.
An event.
It's a nice word.
But actually from whether it's the parking lot
and
or
raise
whatever.
Money for.
Well, not just raising money.
Yeah.
But I'm about now raising awareness.
Yeah.
I want to get people to come to one of these clinics.
Yes, yes.
And we set up and we do a little fet in them party.
Do everything,
Whatever it is. Or maybe we do a live broadcast of this podcast. You know. But from the facility, come out and see.
Listen,
come out and meet. Come out and meet the people.
You know, it's one of my dreams. But I have the resources and I want to go sign in. We need to open a freestanding OV obstetrical care center in the middle of where our people live.
Yes. I know that.
And we man it with proper people. Right? A non-profit institution.
But let us start.
Yeah.
Let us start
with
awareness.
Okay. Awareness. So the FET comes second.
The FET is a part of the awareness.
Now you're talking.
Yes.
That's our society have to understand. Yes. This is part of us and we need to use it.
Absolutely.
Yeah, man. And don't be embarrassed about it.
No,
sir.
So, anyway.
Yeah, I hope I get through to some people to let them know it is nothing to do with them personally.
Right.
It's just the system is set up. And poor people and underprivileged people cannot get equal care to the people in higher places. And we as an organization is trying to wedge that gap. Say, okay, we'll fend some of it for ourselves.
Mm-hmm.
And maybe eventually you get government funds to do this sort of thing.
Right.
You have to choose yourself right. Oh my God, you have to get the funds when your government in. You know, America coming so much like Jamaica.
I'm just about to say that.
Tyrone, I have a good friend in Jamaica, my partner. I ain't calling no name. Anyway, at one time, he government was in charge. And there's my boy, he come pick me up in the airport and we go. So another time I go along there for some other thing and I call him. And you know, we like to meddle with each other. I say, boy, all your ass bust in the last election.
Mm-hmm.
You're not laughing at him. He say, yeah, Winston, yeah, man. I said, well, what that mean? He said, well, it means I sit quiet until my government get back in. And then I'm rising again. And he was a businessman.
That's all.
And that is how all countries operate like this. Yeah. So when and that's why when I see my people tell me they're voting for a certain party, they're mad.
Yeah.
And when I vote now, it has nothing to do with the candidate, it has to do with policies. And that's what the other people do. Yep. They're like your boy, but they're backing him because of his policies.
Can it suit them?
Yes. And we have to start voting how it suits us. And don't listen to all this bullcrap thing.
Right.
Same thing with healthcare. People like us have to get up and stop complaining and try to do something about it.
Absolutely.
And don't wait on the man to do it for you.
All right, Doc. Well, another wonderful episode.
Yeah, but you finished already. We ain't talk. I'm very much interested in the event that we're going to have to raise money for the...
Stand by.
Oh, okay.
Stand by.
I like that word event. Not FET, event. All right. You're learning the system. You're learning it.
Yes,
yeah, man.
You see it.
Anyway, let me stop cutting you. As you were saying, it was a pleasure.
Always.
Right. And don't forget, people look up preterm pregnancy.
All right.
Pregnancy occurring before 37 weeks. However, the problem really starts at about 34 weeks and less. Okay. And the majority of the people who do it are our folks. And remember the other part. Black people get best care for black doctors. And by the way, I'm a little dark. So I'm doing a little advertising for myself now. I would do it differently though, Tyrone. Get somebody who understands your culture.
Yes.
Who live in you going to somebody who you can relate to. You're making a big, and by the way, notice I'm not saying race. I have quite a couple of Jamaicans who are lily white, who understand the culture, who understand you, right? So You have to, when you use your common language, like we and them thing, the man need to understand what you're talking about. You understand too?
Oh, good. Ladies and gentlemen, Medically Speaking with Dr. Winston Alexis has been produced and presented by the Caribbean American Connection. Until next time, stay safe.
We appreciate your time with us on Medically Speaking with Dr. Winston Alexis, hosted by Tyrone Robertson. Join us next Thursday at 11:30 a.m. Eastern Standard Time on caribcast.tv, Apple Podcasts, Google Podcasts, and most other popular podcast platforms. Doc is back. Although the host and guests are qualified professionals, they assume no responsibility for inaccuracies, omissions, inconsistencies, and any slight of people or organizations. Listeners should use their own judgment or consult an expert or their personal physician for specific applications to their individual medical problems.